Hello, everyone. Welcome back to Karan Academy. My name is Karan, and today we're going to be talking about gastroenteritis and how to take a travel history and what to look for. Now, I'm sure you've done this earlier, so today hopefully we'll be building upon that a bit and talking about how would you treat a gastro patient when you have one in front of you, and not just talking about general principles. So again, as I said, I'm not going to be talking a whole bunch about what gastro is because I know you guys know what gastro is, right? What I want to do today is kind of get you to think along some important lines when you have a patient in front of you and you think this patient might have gastro. So let's say you have a patient and they give you a very typical gastro history. My belly hurts. I've been going to the bathroom a lot. I feel pretty sick. What are some questions you need to ask yourself? Firstly, why are they sick? If you suspect this is gastro, are there any particular bugs that stand out? How sick are they? This is really important because the next question would be, well, can I send them home or do I need to admit them? And being able to make that distinction as a junior medical doctor is really, really important. And then lastly, gastro is very common, but could this be something else that I'm missing out on? So let's talk about this a bit more. Okay, so I do go ahead and tell you what gastroenteritis is. So, oh gosh. So gastroenteritis is one of the most common presentations to the GP. And although most cases are self-resolving with supportive therapy, you need to know about the ones that are not. You need to know about red flag symptoms. You need to know about the causative bugs and being able to, I guess, clinically differentiate between a few of those and also be able to take a good history because that's really important. Now, what are the causes of gastro? Well, it can be bacterial, viral, and parasitic. Viral gastro is the most common form of gastro, and about 50% of cases tend to be viral. The three main viruses are Rota, Nora, and adenovirus. Rota is more common in children, and on exams, this is quite commonly described as a kid at play school develops diarrhea after a few other kids in their class do. Norovirus is the most common overall, as well as in adults. And your basic exam question would be that a group of passengers on a cruise ship fall ill. And then you have adenovirus, which I have nothing to offer. How do they cause symptoms? So I don't think anyone's, again, sat down and thought why they cause symptoms. I just have too much free time on my hands. As you can tell by this lecture series, I really need to find better hobbies. What these viruses basically do is they replicate rapidly in the brush border epithelium of your small bowel and damage them. So with damage to the brush border epithelium, you can't reabsorb sodium, glucose, and water really well. And all these agents retain water. Well, of sodium and glucose retain water. Water is water. And this results in excessive fluid in the lumen. And this excessive fluid is what causes that diarrheal effect. And therefore, our treatment approach is going to be just that. So we want to replenish what they're losing. So all rehydration solutions, like hydrolyte, are really rich in sodium, glucose, and water. And they're all things we want to replenish in these individuals anyway. Next, we have bacterial gastro, which is not as common, but can be more severe. And it basically causes symptoms through three mechanisms. It can, one, adhere to the membrane, reducing its absorption capacity. It can invade it further and then damage those brush border epithelial cells. And then certain bugs can also release endotoxins. And these endotoxins, as you can imagine, would invoke an inflammatory response in the mucosa. One important fact about bacterial gastro is that it can sometimes present with bleeding as a complication. And when you have bleeding along with diarrhea, this together is called dysentery. And we'll talk about dysentery specifically and the bugs that cause dysentery in a few slides. Before that, let's talk about taking a good travel history. So I know you guys are very familiar with your WWQQA and knock it out of the park every single time. A travel history is slightly different, right? And just asking where they went to and how many days they stayed there is not going to be enough. So a really good mnemonic that I've found, and I've taken this from Vespads, I'm sure it's used elsewhere as well, but they did a really good lecture on a travel medicine. So please watch that if you'd like. Some common presentations for travel that may require you to take a travel history include things like fever, joint pain, a new rash, jaundice. And then some special things to note if they have things like a fever. You want to ask them the pattern of the fever, how it changes. And is it a biphasic fever? Because certain malarias can present with biphasic and triphasic fevers. And have they tried taking ibuprofen or what they've tried in the past, if that's helped? And then immunizations and vaccinations really, really important. With every country and depending on where they're going and what they'll be doing, you have a list of recommended vaccinations that they should take. And it's important to ask whether they've been taking them, whether they took them before, or if there were any prophylactic medications during their trip. And chocolates is the acronym that Alex taught us. Alex from Westbuds, who's an absolute king. And that's what I've used as well. So chocolates is, just fill these all in. Yes. So country of birth or where they've traveled or where they've gone to. Housing is where they've lived. Occupation, contact. So have they been in crowded areas, sleeping with other people, anyone that's been sick? Medications, so prophylactic prophylaxis like HCQ for malaria or vaccinations, really, really important, as well as recreational drugs. So ask whether they've taken any recreational drugs, and we worry about things like hepatitis and HIV. Leisure, so have they been near rural lands? So mud or soil is important. Animals, any bites, stings, licks, important to know. And then travel, again, where exactly, what season, and whether they had a GP assessment before they actually traveled. Eating and drinking, what they've been eating and drinking, biggest probably thing to ask for gastro, as well as for things like hepatitis. And then finally, a sexual history is really important. So in terms of bugs, this is a summary that I've found since second year and one that I've used throughout. We've got this across a few slides. So I think if you just know this list of common associations, I think that should do you a pretty good job. So fried rice, let's start off, is Bacillus cereus. Diarrhea plus vomiting 1 to 6 hours after food lying around is usually Staph aureus. The reason it's Staph aureus is because Staph aureus releases toxins that mediate this effect. 1 to 6 hours is a very short period of time. And if you ever have a history that short, you wonder about endotoxins. Chronic offensive watery diarrhea is going to be Giardia. And this is very important, especially with travel history. Diarrhea post-antibiotics is going to be C. difficile, and that can also result in a pseudomembranous colitis. Really important for patients who were in hospital for unrelated things like a pneumonia or a meningitis and now have diarrhea. A subacute worsening diarrhea plus jaundice is usually Endomoeba histolytica. Rice water stools is cholera. A diarrhea plus ascending motor neuron symptoms, and we covered this previously, that this is your Guillain-Barré syndrome. And this is going to be Campylobacter jejuni. Diarrhea in someone who's HIV positive is Shigella, and bloody diarrhea after the consumption of chicken is Salmonella. Now, I talked about dysentery earlier. Now, these are the 5 common causes or 5 causes that you need to know about of dysentery. So dysentery is, as I said earlier, diarrhea with blood in it. CHESI is the acronym that I've used. So CHESI stands for Campylobacter jejuni, hemorrhagic E. coli. Wait, am I missing one? 3. I think I'm missing one. And I have blanked. Apologies. If anyone wants to chuck this in or remember them or look them up, please feel free to. I'm sorry. You have Campylobacter jejuni, hemorrhagic E. coli, Salmonella enteritis, Shigella, and Yersinia. All of these can cause diarrhea with blood in them, and that's really, really important to know. Some other important associations is Campylobacter, often with milk, poultry, and animal droppings, and this can often be seen in when it's an exam question, people living on a farm, and that's quite typically the answer. And that's treated with azathioprine or ciprofloxacin. So these, because you have blood in your stools and you're bleeding, we often treat them with a bit more of an aggressive approach, and therefore antibiotics are indicated in some cases. So then we have hemorrhagic E. coli, which can cause hemolytic uremic syndrome. Treatment is still supportive. You have Salmonella enteritis. Again, supportive is broadly going to be the treatment, except if they're immunocompromised. Shigella, sexual contact and males having sex with males, as well as in patients who are HIV positive. And then we have Yersinia, which I have never seen actually being asked, but pork or unpasteurized milk apparently is an association, but again, it's not something that I've seen. And let's move on. Lastly, I had nowhere else to fit this really, so I've just chucked this in here because I don't really know where else to mention this. But we have vitamin deficiencies. So prolonged bleeding associated with vitamin K deficiency, bowed legs with vitamin D, and that's called rickets. Nystagmus, ophthalmoplegia, and ataxia are associated with vitamin B1 or thiamine deficiency. Then you have sore red tongue, peripheral neuropathy B12, and the night blindness is associated with vitamin A. And I hope you guys knew most of that. And that's the end of our talk on gastro. As always, any questions, feel free to send me a message. And as always, please look after yourself. It's a tough year, and look after your loved ones.